I'm Robert McCabe. I'm one of the technicians here at Grady Veterinary Hospital. The subject we're going to cover today is intestinal parasites. It's one of the things that we take more seriously here at the hospital because they are zoonotic, which means they can be passed from your pet to you or from you to your pet. The big things with any intestinal parasite is good hygiene, especially after you're done picking up feces in the backyard or scooping out a litter box. Or playing in the backyard or petting your animal. You just want to make sure that you use good hygiene and wash your hands really well. There are a few parasites that can be passed through the skin, so we also recommend that while you're in your backyard, especially with young children, that they not be barefoot running around in your backyard. The first parasite that I'm going to cover is hookworms. For this video, what we're going to cover is the most common parasites in the Cincinnati tri-state area. So hookworms are one that live in the ground, also can be passed on from mother to pup. So when we have puppies coming in for the first exam, we routinely check a stool sample on them just to make sure that they are not having any of these intestinal parasites. Not every dewormer takes care of every parasite. So that's why we make sure that we routinely check a stool sample to make sure that we're using the right medication to get rid of the parasite that could be in your pup or even in your adult dog. Okay, the second parasite that I'm going to talk about is whipworms. Whipworms are one of the more hardy intestinal parasites that's out there. If you take a look here, you can see the outer shell of the ova of a whipworm, and these can be relatively difficult to get rid of. What we like to do is make sure that they get quite a few dewormings when we see this parasite. These parasites can live 74 to 87 days in the cecum, which is part of the intestine. So when we use the dewormer for whipworms, that's why we do a 3-week, a 3-month, and a 3-day treatment on these guys, because whipworms are very hardy and can continue to replicate inside your dog even though we're using a dewormer. So the whipworm is the most hardiest of the intestinal parasites that we have. The next one that I'm going to talk about is roundworms, and this is probably the most common intestinal parasite that we see. Roundworms are usually transmitted from mom to puppy or kitten through the milk when the mother's nursing. A lot of these parasites are microscopic. Roundworm is one that can be seen with the human eye. And typically what you'll see is a spaghetti type looking worm that comes out in the stool. And the last parasite that I'm going to talk about for today is the tapeworm. The tapeworm is a parasite that is from flea ingestion as your animal grooms itself, or if you have a cat that's a hunter and may catch a rabbit, squirrel, mouse with fleas, they'll also catch these as well. Again, this is one of the parasites that you can see with the naked eye. They look like little grains of rice in the stool sample. Intestinal parasites are a very common thing that we see here from day to day. Things that you want to do is make sure that your dog is on a year-round heartworm preventative. They do call it just a heartworm preventative, but it also has intestinal parasite control in it as well. Not every heartworm pill takes care of every parasite that's out there. So that's why we like to check yearly stool samples, especially when there's young children involved, to make sure that we're not passing on any parasites from animal to human. So an ounce of prevention goes a long way. We recommend also flea control year-round, because you can't have fleas inside your house and you don't necessarily have a freeze in there in order to get rid of the fleas. And as we discussed, those can turn into a tapeworm.